All right, should we wait for Angela?
And Mia just walked in the room. We can probably get started, and she'll be back any second.
Mark, you want to start us off?
All right. Hi, everyone.
Jamie, can you close that door? Yeah.
Do we need to?
Mark, like turn your sound off.
Oh, you're right. That was me. I forgot. Hi, everyone. Welcome to the Oversight Committee meeting. I'm Mark Moore. I work for Home Base. I am normally not attending this meeting, but I'm helping out because of the hybrid format. Alex, my colleague from Home Base, is here as well. You want to introduce yourself, Alex?
Sorry, I have a hard time getting my mute button to come back on. But hey, everyone, I'm Alex. My pronouns are she, her, Aya. And like Mark said, I am with Home Base. And typically, I would be facilitating this meeting, but I am on Zoom because I'm in Southern California. So Mark is there to assist in person. So super grateful for Mark. And thank you, everyone, for being here today. Really excited. We got a lot of things to go through. So yeah, thank you. I'm going to go ahead and go to the next slide. This is just the purpose of the meeting. So to review and assess the development, implementation, and improvement of the COC coordinated entry system, HMIS database, and system outcomes. And let's see. All right, I'll pass it on to Jamie Schechter to introduce H3.
Hi, everyone. I'm Jamie Schechter. I'm a homeless services chief with the Health, Housing, and Homeless Services Division of Contra Costa Health Services, or H3 for short. I use she, her programs, and I will pass it off to Shelby, who's also in the room from H3.
Hi, everyone. Shelby Ferguson, COC administrator with H3, and I'll pass it to Mary.
Hello, everyone. Sorry I'm not there in person. I did want to be, but I'm feeling a little under the weather. Mary Fitzgerald, coordinated entry manager with H3.
And if there are other H3 staff, please introduce yourself in the chat. H3 is the agency lead for the COC and staff of the Council on Homelessness for those who need further introduction. And I'll pass it over to Home Base.
Thank you, everyone. Let's go to the next slide. And actually, I'm passing it back to you, Jamie Schechter.
So in case you're all wondering why we're here in this room in Concord, it's because as of March 1st, all Council on Homelessness meetings and Council on Homelessness Committee meetings were required to convene in person and/or in a hybrid format. So all Council on Homelessness members must attend in person unless using that just cause exemption. So when we go through the roll call and you're attending, if you're attending virtually, just say that you're using a just cause exemption or an emergency circumstance exemption in your intro. You don't need to give us the nitty-gritty. As a reminder, these are the just cause and emergency circumstances kind of situations that you can apply to your virtual attendance. And like I said, again, no need to go into the private personal details. Okay. And I believe I'm passing it to Joan Wayne.
Hi, my name is Wayne Burrow. I am the big committee representative on the Council of Homelessness, and I'm the co-chair of this committee. It's my pleasure to do the roll call council members here. So I'm going to just do an oral roll call, go down the list here, and just let me know if you're here. And if you're not here, let me know that as well. Alejandra Chamberlain. Okay. Angela Bullock Hayes. Here. Okay. Deanne Parent.
Am I here?
I'm not even sure.
Question.
I'm not sure.
I think I am.
Gabriel Lemus.
Here.
You, Joe Bruno.
Present, in person.
Juno Hedren.
Here, I'm virtual today using a just cause exemption.
Okay. Leslie Gleason.
Hello, I am also present virtually using a just cause exemption.
Okay. Mia Fairbanks. Here. And Pat Mims. Okay, Terry House.
I am present.
And Wayne Earl. Apparently I'm present as well. All right, thank you very much. I will pass that over.
That's me. Hi, I'm Joe Bruno, Career Support Specialist with Girls Peers and the co-chair of this committee. Today, our agenda will be talking, we already went through the introductory, the hybrid meeting norms. We'll have public comments. We'll talk about the review of 2023 oversight meeting schedule. And there's a couple of action items that are going to come up that we'll talk about. The review and compliance monitoring, this packed agenda for today. So we'll also be going through the program models and some CE work group updates. And we should be out of here by 1:30.
All right, and if you can go to the next slide, please. I'm going to discuss some of the hybrid meeting norms that we have here. So for in-person, masking is recommended but not required. Masks are available at the door. Please be mindful of social distancing. Please ask. Some people have different levels of comfort and whatnot, so just be mindful of the people around you. Please raise your hand before speaking and identify yourself if you're a council on homelessness member before speaking. Speak as loud and clear as possible. That is the microphone right there. We had some challenges this morning, but I'm hoping that we've addressed that. So just kind of speak at the mic there. There is a 2-minute timer for public comments, which I believe home base will be addressing if need be. If you could minimize distractions, that microphone will pick up all of our jokes. So please minimize distractions.
And candy wrappers.
Candy wrappers, yes. So people that are in person are encouraged to log into the Zoom on your laptop or your phone so you can better see the chat. Make sure that if you're in person that your system is muted so we don't hear the echoing. For food and drink, please clean up and be mindful of smells and allergens around the room. Please maintain a safe and respectful environment, especially and even when disagreeing. This meeting is being recorded. And if the in-person meeting is interrupted for an emergency, the meeting will either be suspended or canceled, depending on a case-by-case basis. And finally, an individual may be asked to leave should they behave in a manner that threatens the safety of the group or does not honor these meeting norms. Thank you.
All right, well, we'll just keep in mind that we'll stay focused on a common goal. It's important for us to notice our power dynamics in the room. Ask questions as they come up, take breaks as needed, and raise your hands. And then I think we're on to the Mentimeter is the next. Who's in the room? Oh, is this QR code?
Mhm.
Hello, let's see if it works. Oh, it's my way.
Oh.
Alice, everybody pulled out their phone. They were so excited.
I'm so sorry. I was gonna pull up the actual website, but I can go back to that. Let me go back to that real quick.
Let's keep it up for about 30 more seconds and we'll.
Yeah. Sorry.
Wow.
Let's see if this works, huh?
I wish
I wish I had a picture of
this.
There we go. Hey, that worked.
What did we do?
Hey, look at that.
Everyone
Okay.
good?
Yeah.
Everyone good?
All right. Yep.
Okay. All right. So now I'm gonna switch over to the presenter screen. So hold on. Okay. Can you all see that?
Yep.
Cool. All right, Joe, take it away.
The questions are, what part of the county do you represent? I can't read the screen, so that might actually be you, Alex, if you're able to tell us.
Oh,
I can help you. If you want.
Yeah, I mean, I can't read the screen from here.
So, and for folks who didn't scan the QR code, you can go to menti.com and use the code 7409 6342 to log in. So the question is, which of the following areas do you spend the most time in across Contra Costa County? The options are Central Contra Costa County, West Contra Costa County, East Contra Costa County, Far East Contra Costa County, for example, Discovery Bay, Bethel Island, South Contra Costa County, or I spend an equal amount of time in all 5 geographic areas. Now I'll put that link in the chat for folks who are attending virtually, make it easier as well. We're seeing a lot of responses for Central, with a little bit on West and East, and one person saying they spend about equal. We got about 13 responses, and that's a pretty good proportion. Next question, do you have lived experience of homelessness? The options are yes, currently experiencing homelessness, yes, within the past 7 years, yes, more than 7 years ago, and no. And then there's an option for those who prefer not to answer. And it looks like most of us hit that no, do not have lived experience of homelessness. And there's a 5 or so who do, either currently or recently or far further than recent. But nobody said they prefer not to answer, so appreciate everybody giving their story a little bit. And the next question, what best describes your racial identity? This should be a multi-select option.
It's telling me that voting is closed.
Oh, Alex, could you
Press C, Alex.
press C?
There you go.
Okay, and here we've got, give folks a couple extra seconds on this one since the internet here is not the fastest and it took my screen a while to refresh. Okay. So we've got majority of folks identifying at least partially white, some folks identifying as Hispanic, Latinx, American Indian, Alaska Native, one person identifying at least partially Asian, Islander, Hawaiian, and at least 3 folks identifying with African American or Black heritage, racial identity. We got some diversity in here for sure, and this one's a little bit always hard for me because it doesn't let you see how many people are biracial or multiracial. Probably, we could probably fix that. Yep. Okay, well, thank you all for participating. I'll pass it back to Joe.
Perfect. Thanks. And we're gonna, up next will be public comments. The slide will come back on. And we'll have 2 minutes if anybody has public, want to go to the next slide. For folks who are in person, can do their public, maybe do it. If you want to go to the next slide, Alice. It shows to provide public comment. There are quite a few ways to do it. We can do it here in person, virtually. You will have 2 minutes to do so. The step-by-steps are there if you want to unmute, but I think we all know how to unmute ourselves. You can also email contracosta@cchealth.org or call the phone number 925-608-6700. And at this moment, I'll leave it open if somebody has public comments. Okie dokie. I don't see no hands virtually or, okay. Well then, we're good. Moving on.
Okay, I think this is my part. So hi everybody. Sorry, I'm a stander when I'm in meetings, so I might not be showing up on this camera, but I'm here. This is just a quick reminder of our 2023 meeting schedule. Since we've returned to in-person, this is going to be our meeting location for these meetings. We are scheduled for June 15th, 11:30 to 1:30, August 17th, 11:30 to 1:30, October 19th, 11:30 to 1:30, and we'll have a meeting in December on a date closer, that'll be identified closer to that time. Our usual schedule puts us really close to those winter holidays that we tend to take time off for. So just another reminder for this group, the schedule has changed from last year's schedule. It's in person now, and it's bookended for folks who are attending both half committee meetings and oversight every other month. And if you have any, oh, sorry, go back one more. If you have any absences or change in circumstances, please do feel free to contact Jamie Jeanette at that contact the COC email. Let her know, and we are more than happy to work with folks. Now I'm ready.
So we're gonna move on to the meeting takeaways. Just want to go one next slide. This will be our action item. And so from last meeting, these are the things that have been approved, what we did. We've selected the co-chairs, myself and Wayne, finalized meetings. We approved the work plan, policy revisions, launched complaint panel review. There's a lot we've accomplished, and I must say, pat on the back. I always love seeing this stuff. So our action item, I'll leave it to Wayne next, is to approve the February 22nd, 2003 meeting minutes.
Would anybody like to propose a motion to approve the February 22nd meeting minutes?
This is Deanne, I move.
Would anyone like to second that?
Second.
All right, I'm going to do a roll call a vote.
Who seconded?
Wayne, I saw Leslie, you had your hand up. Did you want to second or did you have discussion?
That was for a second if necessary, but we're good.
Okay, great.
I'm sorry, I didn't see. Okay, I will do a roll call vote. Alejandra Chamberlain. Angela Bullock Hayes.
Yes.
Deanne Byrne.
Yes.
Gabriel Lemus. I'll abstain. Okay. Joe Bruno.
Aye.
Juno Hendrick.
Yes.
Leslie Gleason.
Yes.
Mia Fairbanks.
Yes.
Pat Mims. Terry House.
Yes.
And Wayne Earl is a yes as well. I believe that passes. I will pass it over to Alex.
Thank you so much. Okay, so now we will do a quick review of the compliance monitoring process, which has been underway in the last couple of months. Let's see. So just to give you a quick overview of the purpose of compliance monitoring, it is to improve system performance by identifying barriers to effective program performance, increase knowledge among COC-funded agencies regarding COC compliance and financial management, help agencies prepare for audits or monitoring from HUD, and to identify opportunities and gaps for additional technical assistance, trainings, or one-on-one meetings regarding areas of compliance impacting multiple agencies. Okay, and so this is these are the categories that we are covering this year in compliance monitoring. So the first one is organizational policies and procedures. An example of that is, does the organization have a conflict of interest policy? We're also covering project policies and procedures. An example of that is, does the project have a compliant record retention policy? And lastly, we're doing financial monitoring. And an example of that is the program spending HUD COC funding on eligible and allowable activities? So those are just some examples of the kinds of things that we're looking for or that we're monitoring. All right, and so the timeline, March through April, we documented, or we collected documents from all agencies, and we are currently reviewing them. In May, at the beginning of May, we will have virtual visits with the agencies to review any of the findings that we have, and ask questions and make sure if anybody from the agencies has any questions as well regarding the monitoring process. And then in June, we will have the compliance monitoring reports. And that's it. Does anybody have any questions? Anybody in the room or anybody
I do. This is
on the line?
This is Joe.
Go ahead, Joe.
The first example, like, does the organization have a conflict of interest policy that organizational policy number uses? Does that actually look like contacting the agency, the organization, and then asking them specifically to see their conflict of interest policy form, and then making sure that it aligns with ours, or like what?
Yeah. Yeah, no worries. Maybe I should have made this more clear, but so we basically created a checklist of the things that we're monitoring for, and we sent those to the agencies. And what they did is then that they gave us all their documents. So we asked for a conflict of interest policy. They submitted their conflict of interest policy. And so then, we're looking to see if it meets the requirements and if they submitted it as well. So yeah, so we had a checklist of what exactly we were looking for, and had folks submit that documentation to support it. Does that clear it up?
That's great. Thank you.
And just to add one other thing on that, it's based on what is required in
Yes.
approval. So basically, we're modeling it based on what HUD would ask if they were to do a monitoring process at these agencies. So we really are going very much by that law.
Leslie, I see that your hand is up.
Yes, thank you. Two questions. One, the first, I'm sorry, I probably should recall this, but were each of the HUD funded programs, did they all go through the monitoring no matter what entity was administering them this year? Or is it still just a subset?
I can answer that. And sorry, I realized I didn't introduce myself last time. I'm just like a floating voice in the room. This is Michelle Burns, and I'm with Home Base, and I'm doing the monitoring with Alex. And so the answer to Leslie's question is yes, it's everyone that is that basically was funded through last year's COC competition. And I'm sorry, I forgot the second part of your question.
Because I didn't get to it yet. So the second part
Okay.
is once we have and you're good, but you probably still can't read my mind.
Yeah.
So once we have these 8 or 11 or 13 reports, however many it is what are we going to do with them? Is there going to be another sort of neutral or non-conflicted, non-involved person or set of people looking at them in their entirety?
Looking at the monitoring reports.
Mm-hmm.
So what happened? So Home Base conducts the monitoring on behalf of H3, and then we give the individual reports as well as a summary report to H3. And then the council receives like a high level report about the overall findings of monitoring. So it doesn't say like by agency, but it's more like, okay, these are some of the overall compliance issues that we're seeing within the COC.
And Michelle, this is Jamie. To back up to Leslie's first part of the question, agencies or projects that were monitored by HUD this year didn't have to do both. So for example, one of H3 COC projects is getting monitored by HUD. So we're not doing multiple monitorings looking for the same stuff. And then to address the second part, yes, Home Base gives us the individual one, since as the COC lead, we're responsible for monitoring. And so we get all the details, but we're likely going to repeat the process we did last year, where we bring the themes and the trends over to this group to report out and to talk about what we do to make improvements and to follow up.
Okay, so then if H3 is being monitored for one or more of the projects, not the ones that are HUD monitoring, who's reading the reports about H3 besides H3?
H3 is, and we share that out in the same format. So H3 programs is operated by different staff than COC. The COC staff provide oversight to the programs just like any other project in the COC.
Gotcha. Okay. All right. Thank you.
Joe, go ahead.
Yeah, so the next, is this, we're done? That was it?
Yeah.
Okay, so the next slide, because I noticed that it says questions and volunteers. So are you seeking volunteers for the virtual site visits and the compliance month? No, it would be the virtual site visits? No. So
No.
what's the volunteering for?
Alex, was that a typo on the next slide? Was that kind of a repeat from when we were looking for panels on
Yeah, question
complaint
volunteers.
policies?
Yes, I'm so sorry. I didn't realize the volunteers.
Okay, I'm like, what are we
That's
volunteering for? Nothing.
That's what happens when you
I'm
copy
not
paste
even
the slide.
on your toes. I'm ready.
Sorry.
Questions. And we will
Scratch
take-
that.
Because I'd be
Sorry,
interested in
y'all.
volunteering my time to visit those sites, but that's just me.
I am so sorry about that. Does anybody else have any other questions? Looks like no. Anybody in the room?
Nope.
Okay, cool.
Wait, but
I'm
not
just
one.
trying to open the document, but Wi-Fi. Is this monitoring of the policies and procedures also related to the self-assessment tools that we submitted?
Somewhat. That's a really good question. The self-assessment tool, for folks who don't know, when we implemented the COC program models, we gave folks, our providers, a self-assessment tool so they could say, okay, well, here's where I am right now, and here's what the program model says. Here's what I might need to either reach that, or here's where I'm already excelling at. All of that, and that's meant to really be a conversation starter of like what resources are needed to get to the program model standard, what areas should we be keeping our eyeballs on, what areas should we be highlighting. And so that might be helpful when having that virtual site visit to talk through either findings or areas of opportunity. And there are components of the program models that we built into monitoring this year. So we asked about demographics of organization staff because that's in our program models. So we're trying to make sure that we're blending the two. So people aren't getting one monitoring for HUD stuff, one monitoring for program model stuff, and then probably a million other monitoring from all the other funders you guys have, right? So that they're related in that way, but not like directly. You didn't have to do a self-assessment tool to get monitored or vice versa. Gary.
Yeah, I have a couple of questions, probably for home base. One is, so I understand that this year, all of the agencies are being monitored in order to kind of establish some sort of a baseline. In the following years, are you going to be going to some sort of a risk analysis so that you will then only select certain agencies? Or are you going to monitor all agencies for different aspects of their programs? That's question one. And question two is, are you using the HUD monitoring manual questions for COCs? I don't know whether they have it for COCs. They do for CDBG, so.
This is Michelle from Home Base. So we did 2 years ago a kind of pilot monitoring project that was some agencies volunteered for that. Last year, we did a comprehensive compliance monitoring where it was all agencies, and we did all of the categories Alex talked about, plus client files. And then this year, we are again doing all projects, except for the ones that are being monitored by HUD currently, except we are starting an alternating approach where this year we're looking at project and agency policies and procedures and finances. And then next year we will be doing client files and we'll basically be alternating. And then there is a discussion about potentially moving to more of like a risk mitigation model, but at this point, this is the current approach.
Thank you.
No more hands in this room.
Okay, I don't see any virtually either. So let's move on to, all right, so I'm gonna pass it over to Mark, who will be reviewing the written standards revised COC written standards for recommendation to the COC.
Thanks, Alex. I'm gonna pin my spotlight, my Zoom screen so you can see who's speaking, at least folks who are virtual. Hi again, everyone. I'm Mark Moore. I'm with Homebase. Gonna cover an item that we talked about a little bit at the previous oversight meeting. It's about the COC written standards. If you recall, if you were at that meeting or you looked at the minutes, the committee wanted a little more time to review the revisions to the COC written standards. So we pushed it to this meeting. So we are hopefully gonna review it together and see if y'all want to recommend it forward to the council for approval. But I'll go ahead and do the same kind of overview background about the COC written standards that I did at the previous meeting. Today, again, we're hoping to understand a little more the purpose of the COC written standards document and learn about the proposed revisions. So we can discuss any questions or concerns you all have about the proposed revisions. And then, like I said, the action item is going to be to consider recommending the revisions forward to the council. Next slide, please. Just a little bit of background on the COC written standards. It's a document that's aimed at ensuring a high and equitable standard of care throughout the COC. We just talked about monitoring, so adherence to these standards are monitored, and programs receiving COC or ESG or other funding that's administered by H3. Those are the programs that typically are monitored for adherence. And then these written standards that were initially adopted, they were adopted in 2019. And so that was done with deep involvement from the Oversight Committee. So that's why we're bringing it back to this committee. So this is going to be, what, 3-4 years later? So they haven't been updated in some time. Next slide, please. And so just a quick overview. These are the general kind of purposes of the revision. Just want to state off the bat, this is not an overhaul of the COC written standards in any way. There are quite a bit of kind of updates that are, I'll talk about it later, but just trying to improve readability and update the table of contents. And so it just, if you looked at the document, if you had a chance, it was sent with the materials, you'll see a number of markings indicating there are edits. But again, the overall intention was just to kind of update it to what's currently happening in terms of policy and practice. So like I said, so the first kind of broad category, and I'll go into these in a little more detail, was just to update this document with current processes, practices, and guidance. The other big aim was to align this with recently updated system documents, such as the program models and performance standards, which was referenced earlier, coordinated entry system policies and procedures, and a COC complaint policy. So those are kind of the big documents that have been updated recently that we wanted to make sure we're aligned here in the COC written standards. Like I said, also just to improve general readability, clean up some of the headers, eliminate redundancy. We put a bunch of hyperlinks in there. We wanted to really try to reduce the number of pages there so that if we could just link to a different document that exists somewhere else, we try to do that. So that gives you just an overview of some of the big changes. Any questions at this point before I dive into a little more detail?
This is Gabriel.
Gabriel.
Just, it says COC written standards, but I believe they were always titled COC/ESG written standards. Is that correct?
Yeah, so when we first started the revision, Gabriel, that was back a year or two ago when we had the kind of that working group, if you remember. And I think we had decided at that time that we would change it to COC written standards and take out the ESG. I think that's what the group chose.
Well, the reason why I ask is because HUD always combines them. And they're always asking, can we see the COC/ESG written standards? So as long as ESG is included, that's all that. And I bring it up because I administer the ESG program, and it's a strange thing that the ESG is housed in a different department, and it's like this in most counties. That COC programs are housed typically in the health services department of most counties, and the ESG program is housed in the department that administers typically the other federal programs that come with CDBG code, and then ESG falls under that as well. And nobody knows why, but I think the main reason why is that those three programs, CDBG, code, and ESG, fall under what's called the consolidated plan for those programs, where the COC does not. I'm not sure why HUD does that, but that's how they do it. And it kind of complicates things. And as far as the title, I mean, the title is not that important in my opinion in terms of just for formal submission to HUD, as long as the ESG is included with all that and it doesn't affect, which I haven't heard that it would affect the ESG program or the performance measures for the ESG service provider. So I don't really have too much of a complaint whether ESG is in the title, but as long as ESG is formally recognized as a program that has to also adhere to these standards, which they previously did, then that's the only thing.
That is included in the purpose section in there, that ESG and COC funding are required to abide by written standards here.
Okay.
I was just wondering who monitors for ESG would be you, right? So
Well, yeah, it would be me and
using
Mark,
these standards, right?
yeah.
So,
Well, the standards, I mean, they tend to be, it's kind of it's a guide, it's a policy, and it doesn't necessarily go into like the details to the nitty gritty details of each service or each component, which typically they're called out in the standards. And by components, I mean emergency shelter, rapid rehousing, homelessness prevention, HMIS, and at times administration is put on. So that's, and it goes into the general performances of each component, but it doesn't go into the details of how service specific. It does go into some general detail, but it's very to go into how things are done within each service provider or within each component. It lays out kind of the framework, and in terms of filling in that framework, it's done more within the actual specific program.
And I saw Dean's hand up as well.
I guess I would ask you, since you are interface with HUD on ESG, would your life be a little bit easier if we had it up in the title? You know, I'm all about clarity of communication, not making people even have to dig down to the first paragraph to answer the question, does this apply? Is this what I need? It seems like it might make your life a little easier.
Well, it might. The good thing is that HUD typically assigns the same rep for both ESG and COC. We share the same coverage. So we have to attach these written standards to our, I forget if it's our action plan or our KPIs annual report. But either way, they always ask it, and we need to attach it.
would you like it?
Yeah, would
Yeah,
you?
We can do this right now. Yeah, we can get the pencil. We can-
Yeah, we could do it.
I don't know if it would make my life easier, but it probably would avoid the question of why is it ESG not in the title?
Would it,
I
so would it
move
make your
that we
life,
add ESG to the title of this document.
would it make your life harder? That's-
Whether it makes it easier or harder, I don't know. It might just avoid a question.
I think that's making it easier.
And I have one more question, which is on the Measure X funds. Are they also then as we implement this, going to be adhering to these same standards? And do we need to add any wording for that?
We do not need to add any wording into these about Measure X because HUD won't care. Measure X funds for our recommendations will adhere to our program models, which are referenced in the COC written standards, but they won't have to necessarily adhere to all the extra lucky HUD compliance requirements to the same level because they're more flexible. We're not going to tie anybody to these unless we have to.
Yeah. But one of the reasons we may not want to is that some of the Measure X DC funds and DCD has for services, we're not necessarily requiring them to have to be entering into HMIS for these standards indicate that you pass.
Got it. Yep, thank you.
All right. So appreciate the conversation, the discussion. It sounds like the group wants to add back to the title ESG. Any opposition? Any questions about that? All right, we will add that back. And we will keep going with the presentation. Next slide, please. So I'm going to hone in each of those kind of three general categories of changes. So you see some of the most important changes. So this one is update with current processes, practices, and guidance. So just highlighting a couple things. We can share the doc on the screen if you want to, but I'm just going to put the page numbers there for now, but let me know if you want to hone in on anything or if you have a question. We included the updated Violence Against Women Act emergency transfer policy that was in the coordinated entry policies and procedures. Wanted to make sure that was here as well. Updated and strengthened the kind of the equity language on page 15. We updated the housing first definition a little bit. And then we updated some of the training topics, in terms of COC trainings that are provided. We're talking just about monitoring process. There's a new monitoring process, at least compared to what the process was in 2019. So we've updated that language. We added some of the COVID-19 pandemic response and guidance that we've received from the state. So that's in an appendix towards the end of the document. And we've also updated some of just the language around participants, lived experience. We've had a lot of conversations within the COC about how to be more inclusive and use terminology that folks of those identities would prefer. So we want to make sure that was reflected in the document as well. So those are some of the big changes around this kind of category about updating with current process, practices, and guidance. Any questions? Anybody want to see anything in the document itself? Okay. Next slide. Oh, Leslie, I see your hand raised.
Yep, super quick. So the COVID-19 response and guidance language, pages 42 to 44, are those the same ones that we saw before, or was anything changed since there have been some changes in the public health emergency order, blah, 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 blah?
It will be over again.
Yeah.
The federal emergency.
Okay.
Great question, Leslie.
So
Let me pull it up real quick. Sorry. Go ahead, Leslie. You were going to say something?
Yeah, so I thought you were summarizing that no, there hadn't been any changes, but I'll wait for your answer.
42. And Alex, if you could pull up the doc just to be ready in case you want to screen share anything, that would be great. I'm just pulling it up on my computer.
I mean, I guess I would wonder if anything has changed in any section since when we all last saw it as this committee, but specifically.
You're saying since the last time you saw it?
Right, since the last time we saw it. Did anything change in the COVID section?
No, nothing has changed in this document since the last time this committee saw it 2 months ago.
And
Perfect.
what I will say about that section, because I see Mia, is that it's really meant to be a historical, hey, what happened during the pandemic? What was our response? What were waivers that we took advantage of? And what are the guidelines and resources that we've tapped into? It's not necessarily saying we're currently operating under these in perpetuity. So it's not written in stone in that way.
So it's not requiring any operational changes going forward.
Mm-hmm. No, it talks about safety guidelines and adhering to county and state level sort of guidance, but it's not like pinning it to a specific notice or public health officer recommendation. because that gets stale like that, as we all remember.
Thanks, Leslie. Any other questions or comments before we move to the next slide? Okay, next slide, please.
Sorry, I had a question.
Yeah, go for it.
Regarding training, will the critical time intervention be required as well?
Yeah, it was required and we did the training back in August and September. I don't think, I'm not sure if we were able to post the links. We're having trouble because they're so large. But if you want, I can send you a link directly.
Well, I guess, I mean, in these standards and the training requirements, is that something that the COC will provide annually? Should it be in this list? Or maybe I'm just missing it, I'm not seeing it.
So CPI is required for rapid rehousing providers, sorry, to like put a more finer point on it. And the COC did provide it, and as when we have new providers come on, it was kind of a train the trainer type model. So we provided the training to a new provider that came on back in February, actually, so that they were onboarded to CPI, critical time intervention.
Got it. So this is more so for all, you know, regardless of project type.
Yep.
That's what this list of trainings are. Okay.
Great question, thank you. All right, next slide, please. So this is the second kind of umbrella of changes aligned with recently updated system documents. The program models and performance standards, we added really high level language there, just like the real basic description of each of the program models, and then we hyperlinked. So that's why that long document fits on 2 pages here. So and then the COC complaint process, we updated that language. I think this committee is very familiar with the current complaint process. And then coordinated entry system policies and procedures, which is something this committee actually also reviewed and recommended for approval at the council last year. That language is in there as well. Any questions about anything here on this slide? Okay. Next slide, please. And then this category is a little bit of a catch-all. Just wanted to improve overall readability. So we cleaned up headers, we updated the table of contents, just trying to make things a little more clear and easy to kind of sift through, especially for providers. We were trying to take the lens of what providers wanted to see here, most likely, and be able to navigate easily through. Like I said earlier, we inserted a number of hyperlinks, so they're in there. We also tried to eliminate redundancy. So if you see like whole sections deleted, that's likely that it's mentioned somewhere else in the document. Or we just thought it didn't need to be necessarily in the written standard. So if you have any questions about any of that, feel free to chime in. So yeah, any thoughts, questions, comments about anything on this slide? Go for it, Jamie. Yes.
And I'll just add, we did our best, and we're not perfect by any stretch, to make the language much more accessible. So we always aim to reduce jargon and acronyms and spell them out where possible. And for graphics, we also sought to make it more accessible by including alt text, so folks who have low vision can still get the benefit of the graphics we put through the document.
Thanks, Jamie. All right, anything in the chat?
Nope.
Okay. Next slide, please. So this is the process. Oversight would recommend the revisions to the written standards for council approval. Council, if y'all agree today to recommend it forward, then I think we're looking at the May meeting to approve written standards of council, and then thereafter they'll be shared. The revised standards will be shared with providers and the COC at large. Next slide, please. Any other questions before I kick it over to Wayne, who I think is going to lead us through the action item? Next slide, please, and I'll pass it over to Wayne.
All right, thank you, Mark. Now we're going to move on to the action item, that is to recommend the revised COC written standards for approval by the Council on Homelessness. Would anybody like to make that motion?
I would like to.
Okay.
This is Joe, I'll second.
No, wow. May I make a comment? Maybe on the comment section? I just want to say it because I know I was part of the bottleneck for this process at the last meeting, asking for a little bit more time, and I really appreciate the time. And I think this document is amazing. I think it is so easy to read. It is so well written. It captures so much of the hyperlinks are fantastic. It's just really an excellent piece of work. So I really applaud everybody who worked so hard on this, and thank you for allowing the extra time. And I wanted to move it, but I will vote for it.
Okay, so
Are you the second?
No,
Oh,
it's
yeah.
it sounds like we have a motion, a second, a third, maybe a fourth, I'm not sure. So,
So real quick, just, you all wanted to edit the document to add the ESG name back to the title?
Yes.
Just wanna- If you want to state that aloud,
yes,
for formality's sake.
so who made the motion? Carrie, do you want to add that?
Yes. Recommend that we revise the name to include ESG and that the revised amended COC written standards for approval by the council.
And I'll second that a second time.
Good times.
Is that?
And in the discussion, just to highlight Leslie's comment, she said she also appreciated the extra time. Thanks.
Yes, yes. Maybe we should get to the Rochambeau for seconding. Okay, given that, I'm gonna go do a roll call vote here. So I'm gonna read the names going on down. Alejandro Chamberlain. Angela Bullock Hayes.
Yes.
Okay, we got Deanne Kern.
Yes.
Gabrielle Lehman.
Yes.
Joe Bruno.
Yes.
Judo Hedrick.
Aye.
Leslie Gleason.
Yes.
Mia Fairbanks.
Yes.
Pat Mims. Harry House.
Yes.
And Wayne Earl is an aye. So I believe the motion passes. Pass it over to, I believe, Shelby is next.
Well, before we, sorry, this is Gabriel. Before we move to the next item, this is going to next month's COC, or sorry, COH. Or Council on Homelessness, sorry, should be using action.
Yes, it'll be on the May agenda.
All right, and pass it over to Shelby, I believe that's it.
Thanks, Alex. If you can go to the next slide. I'm going to give a brief update on the program models and performance standards. So recap from last meeting, what we said we would kind of talk about would be discussing the program models and discussing some specific data points. We said we hear from providers on how the implementation of the models has been going and discuss some potential improvements and some next steps, as well as integration of these models into 23-24 contracts. Alex did a nice little hyperlink to the models if you want to look at that 70-page document for some light reading. Next slide. So as a reminder, we've talked about this, I feel like to death, but if you're new or don't quite remember, there are 7 different program models that we're talking about: permanent supportive housing, rapid rehousing, prevention and diversion, rapid exit, outreach, emergency shelters, and care centers and care center case management. So those are the 7 types of programs that we're talking about. Next slide. A recap on the performance dashboards. We've talked about this at the HMIS policy committee meeting. So if you've been to those, you've heard a lot about it. Essentially, these are tools in our homeless management and information system for agencies as well as H3 to monitor their performance at a system level, but also at the individual agency level. Each of the 7 program models has a performance dashboard in our HMIS system that helps agencies track their performance. And each of the dashboards are categorized into 3 sections. There's a demographic section, there's a performance outcome section, and an equity section. Next slide. So I want to give an update kind of currently where we're at with the program models. So currently we're doing quarterly, H3 is doing quarterly provider meetings. During these quarterly meetings, we're reviewing the previous quarter's dashboard, looking at that data. The agency as well as H3, we're giving feedback on how that quarter went. highlighting any achievements or improvements that we think we need to make. And then really focusing on identifying goals for the next quarter. So we may be looking at the data and say, a certain data point doesn't look so great. Let's focus our attention next quarter on that. So that's how we're integrating some contract monitoring in this process. Next slide. All right, and I wanted to give, no pressure, Deanne or Leslie, but I did want to give providers a chance at this level to talk about how the program models have been working for you all. We're in month 10, I think, of implementing the program models. So I want to find out kind of what's been working well for you all. What do you hope to see for next year? And then what do you think really needs improvement? So Deanne, if you want to start, I'm happy to give you the floor.
Sure. Again, a really great effort that was a long time in the making. And I think it's really exciting that our community is at this point. I think what's been working well is that we have really clearly articulated program models, staffing structures, outcome benchmarks. You know, it's really clear what needs to happen and what the expectations are as a provider. And I would say we really we have been relying on these documents in our proposals. It's opened up some interesting dialogue about, gosh, we have some programs that are funded to do a set of services and they are nowhere in the line or funded to meet the sort of staffing standards. So how do we do, what do we do as a community to sort of move the needle on that? So it's created just really good clarity and dialogue and transparency in a spirit of, we're all building the system together and how do we improve it together? So I think it's really been tremendous. I think what I'd like to see for next year and what we want to improve is obviously it's very data dependent. And so we have to trust the data and it has to be quality data. And as we've gone through and we're in constant dialogue with our partner, sometimes our data doesn't match up with what's in the HMIS data. So there's work to kind of figure out what's going on there and get these things aligned, but that's an ongoing process and is happening again without blame and shame and in the spirit of we're all making things better. So I really I'm proud of this community for this body of work. I think it's really impressive.
Leslie, do you have any feedback that you would like to add?
Sure. Happy to. First off, where Deanne kind of ended is where I'd like to start. It's great to have the clarity. It's great to be able to say, this is what we mean when we say we're doing X, Y, and Z. And also the ongoing honest conversations and honest look at where HMIS and our own systems don't always align to make sure that we're measuring the right thing in the right way so that we can assess if we're hitting the targets as individual providers and as a system that we want to. So let me back up and say also Trinity Center is a care center. So that's the performance model that I can reflect on most thoroughly. And I would say we've learned a lot about HMIS, how we've been capturing data, how it may or may not necessarily tell us all we want it to, but the red team and Shelby and Mary and everybody have been great about looking at the warts as well as the beauty of the system. So I look forward to continuing that conversation. I think the other thing I would reflect on is that thinking about how the model works really on the ground with real people who are in the crisis and struggle of living unhoused, it doesn't always flow as linearly as we might like. So with respect to the care center model, which focuses on how do we focus our energy and efforts and HUD dollars on providing effective housing focused case management, I think, we'll still be learning boots on the ground, how we would love it to work might not actually always fit well with the real lived experience of the people we're trying to serve. And so where does the model need to bend or be flexible as we go forward? So I would say open conversation is what I'm hoping to continue to see through this process. Trinity Center specifically, we just need to keep doing it and make sure that we're able to deliver on the promises that we make when we're engaging with someone on housing focused case management, and we're relying to be able to have a certain resource throughout the rest of the system, and we don't control that resource. We have to, as a system, be really good at communicating so that we're not creating or continuing to create false expectations on the part of the people who are counting on us to deliver good quality information in a timely manner so they can do what they need to do so that they can get on to being rehoused. So those would be my reflections, but I've been happy to be part of it, grateful for the ongoing conversation, the attention to detail, and the openness to be honest about where it's hard and where it's easy, and who at the end of the day we're trying to make it work for. So thank you.
Thank you, Leslie. Can I add 2 other quick comments about what I'm hoping will work on this next year? Some of these models are more refined than others. So there's a couple places where we have like case management ratios, and we have one case management ratio across the board, whether it's singles, families, and we're not really accounting for the acuity of need and the intensity with different populations. Like TAY might need a lower case ratio. Families would need a lower case ratio than singles, and there isn't room yet to build that into the model. And I'm hoping we can use our data to maybe tease that out and get a little more refined over time. And then I lost my second piece. Oh, also, again, with benchmarks and data, we have a couple of new models that we've just written in, like prevention and rapid exit. And I think we as a community took our best guess as to what caseloads and how many people we can serve with this intervention. I want to be open. So again, looking at the experience, like Leslie's talking about, taking a year's worth of experience and saying, oh gosh, maybe our expectations were too high or too low with how many people we can really serve with this intervention.
Yeah. Definitely. Sorry, taking some notes. And Janelle, I didn't know you were going to be here, so if there's anything like on the data side that you want to speak to, if you have any feedback.
Yes, well, first of all, I love the program models. I look at them all the time. I really appreciate the clarity of, to piggyback on what Deanne was saying, the clarity of the document is just, I can go right to it. What are we supposed to be measuring? Are we measuring it? Are we meeting the benchmark? Yeah, that's great. I think it's been really good, a really good tool to communicate with end users and just with case managers on the ground. This is what we are measuring. So I found that to be really helpful, just providing internal trainings. One thing I'm personally curious about is what the plan is for the equity measures. So we are looking at, different equity measures, but like, yes, we're looking at it. And I guess what is the end goal? And particularly around like the higher populations. So we're measuring that, and I guess what's the next step? So I'm curious to know more about that, or have discussions about that, and understand the plan. And I think what would also be helpful is to know more about the programs. So we're able to see everybody's programs. I love the transparency, so that's great. But, is this a rapid rehousing program, for example, that focuses more on employment services? Then, that would be good to know about that particular program that doesn't exist in my agency. So just having just more descriptions on what other folks are doing. What are these programs focused on? It's not just a rapid rehousing. What is the, what else is there to it?
I really appreciate you bringing that up, Janelle, because the equity measures in the dashboard, I feel like aren't fully fleshed out yet. We still could use some work on that. And it was kind of like our first attempt of like gathering that data. And with the monitoring process, asking agencies for that data. So I feel like that was kind of year one, our first attempt to just gather the data. In year 2 and year 3, I think we can actually have some conversations of what we can do with that. And we'll be talking more about like what year 2 and year 3 of program model implementation could look like.
And I'll add, when we kind of started this, we didn't have the state thing with your HAP money, set equity goals, or set specific subpopulation goals. So we have a little bit more there too, that we can see how they're working with our program model. Are there things that we're pulling from, the other goals that we're setting across our funders that we could pull down and measure the same thing across these different layers that we have in our system. And then to the other point, we've gotten that request in different ways actually recently. So we're going to work together with Home Base to put together some sort of 1 or 2 pager of here's the COC funded projects. Here's like a brief little, here's what they do kind of document. Yeah.
So this is usually something I drop in the chat, hashtag Joe style. But can we like send her a thank you note for the good job that something like
Elaine,
like I feel like she needs to get
It's
some
gonna
sort
be
of kind
coming
of
in
that.
June.
Oh,
So
see,
she's gonna come to the meeting in June
Oh,
and give
so
a like a
So we
goodbye.
can
in
fly her.
June, we need to do something. I'm like, there needs
Fly her
to be
some
some
coffee.
sort of to hear this feedback and doing the work that we did with her and everything, like all of that back and forth, and then to hear this, I'm like, she needs, I don't know, something, a high five, a kudos, more emojis, I don't know.
Emoji. Yeah, she will be coming to the June Oversight Committee meeting, and we will be doing kind of a wrap-up presentation of year 1.
I see a party coming up for this.
Alex, let's move to the next slide so we can keep going. All right, so I did identify some next steps, which are slightly revised from the initial next steps that we identified in February. So there's kind of 2 things, some training. We'll continue to do and provide HMIS training that's necessary. If there's one-on-one technical assistance that's needed for the dashboard, we'll continue to do that. We'll also be providing, Leslie, to your point, more trainings and more targeted trainings on housing-focused case management, specifically for models like the care center that we're asking you to do something that you maybe didn't do before. We will be doing some trainings on, to your point, Deanne, caseloads, how to prioritize those specifically, again, Leslie, at care centers. We acknowledge that there was a lot of changes in that care center model. So we want to support you all on that. And some tools that we will be doing, or some things that we actually already have done, is the red team, our research, evaluation, and data team, worked really hard on creating a follow-up screen. And so providers that are doing follow-ups at 30, 60, 90, 120 days, they have a function in HMIS to be able to do that now. And thanks to you, Janelle, we were able to build a report that agencies can use that will let them know who needs a follow-up. Because providers are coming to us saying, that's great that you want us to follow us, but we don't know who we're supposed to do it on. And we would have to manually track that. It's a lot of work. So we created a report, our red team did, they're fantastic, to be able to track that better. So that's easier for you all. We also are going to be rolling out a housing stability plan, just kind of like a case plan or action plan. That will be in HMIS, hoping to do the training in May. It's still in draft form, but that's going to be coming.
Does that mean stability once they've received housing? Is the support, or what do you mean by housing stability?
So that's going to be like a case plan. So it'll have like goals where they can identify what goals they have for housing. So do they need to get their documents? Do they need to get connected to benefits or a job, whatever it might be? And they can set target dates. They can assign it, whether it's to the staff member or to the participant, and it will live live in HMIS. Okay. A lot of our providers have that kind of in paper files at this point.
Yes.
So we want it to be electronic.
Gotcha. Thank you.
Yeah. Again, we really will be focusing on the housing focused case management. And I wanted to give a plug for the participant satisfaction survey. Again, we talked about it this morning in PAC. So sorry if you're hearing it the second time. We will be implementing that in July. So all of the COC providers within the program models, you'll be able to use this survey with your participants and your programs. There will be some like required questions and then others that will be optional. Some providers said, hey, we kind of already have a satisfaction survey. We'd like to continue using ours. So we will be working on integrating that starting in July.
And I'll highlight that survey was developed by people with experience. So it wasn't just agencies sitting in a room thinking, what do we want to know? It was Emily, our intern, and Shelby worked together, folks over a few meetings, and get some really good input and be able to offer providers at all levels. If you need a full survey, you haven't done one yet, you got that. And if you don't, here's a couple questions we want to know across all the programs.
And Joe was a big piece of that.
Can I ask, I think really just really quick, data that you get back from that, where will it go and when do we get, I mean, it goes out in July, so we're thinking maybe December that we'll have just like, or are we looking maybe like the next month? What's the timeline?
We'll probably give a month for data collection. Again, it will be optional. Participants can decide if they want to do it. We'll give people a month, and then we'll probably need to spend a few months looking through the data. I'll be relying on our red team data specifically to be helping analyze that, because it's going to be qualitative data. So this is really going to be looking at participants' experience in the programs. Like we talked about at TAC this morning, we have a lot of quantitative data, but we really want that to go hand in hand with what we have in our HMIS system and see where it reflects and aligns and where it might not. I think that's it. Alex, is there another? Just kidding. We do have some data that I was going to share. Yeah, just kidding. Okay, so very quickly, I wanted to share a little data, not a lot, because it hasn't even been a full year, but wanted to share some highlights. So the report period that I ran was July 1 when we implemented the program models to March 31st, just to give us a decent chunk of time. Some highlights that I saw in the dashboards, particularly were exits to housing, and really want to highlight emergency shelters and core outreach did a phenomenal job in exiting folks to housing. That's temporary or permanent housing. And if you want the breakdowns, I wrote that down because I knew you would ask of what is categorized in temporary and permanent. We can go through that. But the goal for core was 35% of the people they're working with exit to permanent or temporary housing, and their performance was 53%, which is fantastic. Again, that does include exits to shelter, because that is one of core's goal, is getting folks into shelter, which is still great. And then the shelters, their goal was 40%, and their actual performance was 73%, which is really fantastic. And that's on average. So some shelters were slightly higher, some were slightly lower, but on average, 73% of their population exited housing, which I thought was really fantastic. Next slide. Leslie, do you have a question?
It's really just a note to self to talk about this at some point later on, but I would love to know if there had been more shelter capacity, could CORE's outcome on that have been even higher? You know, what's the rate limiting thing? I would love at some point to have a conversation about that as part of our system. But please go on.
Yeah, thank you, Leslie. And then I did want to highlight some challenges that I saw on the dashboards and were definitely reflected in my conversations with providers. One of the biggest one was obtaining health insurance and benefits. Across all 7 models, that goal was not met. And we set it pretty low. I should have wrote the percentage down, but I think the way we're planning on addressing that is doing some additional training with our red team on how to capture those updates, because essentially what we found is providers really feel they're doing the work, but they weren't accurately updating in HMIS to reflect that work that's really being done. So I know our data quality and training person, Tammy, she's done some specific trainings with providers on how to capture those updates. Tammy?
So I had feedback on the difficulty in doing this step, as opposed to maybe a separate issue, but part of our intake for our program, we get them in the first 30 days of the program, we get them completely documented, ready with social security cards, ID cards, but we also get them Medi-Cal into the county. And that is a multi-day, sometimes multi-week sit on the phone, on hold, people sitting like literally for hours, and they have to do it themselves because it's their medical information. So some of the barriers to entry with that just might be the process itself. You know, it may be easier getting a shelter bed than getting through to I'm just wondering if there are possible ways to streamline that process for providers. Maybe a whole you know, into the health system. Is there a way that we could streamline that for county providers?
Yeah, we've definitely been talking about that, specifically for like DMV or Social Security Office, and at the program levels, at certain programs, we've been able to kind of implement that, but not at a system level yet. But that's something that we can definitely talk about.
The system failure, I think we can.
And we're part of the
totally
health
look into that.
system.
Yeah, and that's why I bring it up.
Yeah.
So, and even more, it's even harder when the transfer to another county, you know, which is very common in our program, Alameda County or something. So.
Yeah.
And Juno's
I
hand
heard
is up.
that they're making the, because the Medi-Cal kind of, everybody's gonna have to do their annually now. Because they're moving forward, their first set of Medi-Cal applications are going out right now as we speak. So, so those will be going to wherever address that somebody had on file, who knows, you know, if they're gonna get there, but my understanding is that they've made the actual website a little easier to be able to sign up. So I think, I don't know if that's, I mean, it's gonna help us a little bit. We're gonna go through that for healthcare problems, you know, and start really kind of working on in Epic. I know they're gonna have a flag anytime somebody comes up and they're ready and they're gonna renew. So we'll be able to see, like, we're seeing that patient, we can go ahead and start that process with them, find out what, and it'll also be able to tell you like where they are in the application process. So I think there's hopefully more to come on, hopefully a little easier way to do that online at least. So we might try to provide like iPads, you know, that they can kind of get on and do their, you know, if they want to sign up, do all of that. So we're looking at that as well. It's gonna be big now that everybody's gonna have to do the annual again. So.
Juno's got her hand up, yeah.
So if we are thinking about taking a look at Medi-Cal stuff, I definitely think there also could be a pass taken on how we sort of, I guess, maybe train or inform our interviewers in order to best support people applying. Having experienced this recently myself, actually, the last council meeting where I had to step out was my Medi-Cal interview. You know, I know it's not fully something that can be entirely controlled just because of how many people apply, but if we are taking like a systemic look at if we are taking like a full systemic view at it, like I got my notification to do my interview at 11:30 that day, you know, while on the way to the council meeting. And like, additionally, it was plainly obvious, even though my interviewer was 20 years in doing this type of thing, she said that it was plainly obvious she had no clue how to deal with me because I was transgender. And that created a very interesting start of the interview where I was waiting to see how long it was until she would ask. You know, she first she accused me of not being me, and it was only because of my voice. You know, not so it was. I will say that was a bit tense, and if we are taking a full systemic look at it, then that is also something maybe we could take a peek at the way that those interviewers are trained, because it really surprised me. I was like, I didn't ask her this because obviously I didn't want to create too much friction in the moment, but in my mind I was like, you've been doing this for 20 years. Have you never been trained how to give this interview to a trans person? Which I find that really hard to believe, but it may be true. And like, that is definitely something that I think should be addressed.
Yeah, definitely. Sorry to hear that experience, Juno, but thank you for sharing.
But I'm also gonna say this too, like, if she came back into the meeting and she was on point, like, went right, so, big hearts, all the emojis, I'm all like all over the place with that. Yeah. Wow.
I think we do have to keep going so we don't take too much time. I know Mary has her section left. And I'm done. I don't think I have a lot of time left, so I want to go ahead and let Mary speak. But if you have questions, feel free to reach out to me.
Thanks, Shelby. Hi, everyone. So what I will be speaking about today is our CE work group. Yeah, jumping right in, I wanted to start with a quick recap of the CE work we began last meeting, which was launching the work group to begin the process of redesigning our assessment tool or replacing our current tool, which is the VI SPDAT, and updating our prioritization process. As you know, this was a result of an area of suggestion revealed in our 2022 coordinated entry evaluation that was conducted by Focus Strategies. That evaluation revealed this area as one needing improvement and examination. So in order to begin the work or project, which is very large in scope, we took the first step in our last meeting of approving the creation of a work group. The work group will help us take the first steps in launching the project. Next slide, please. So given that this project is extensive in scope, we know it will require support from an external expert. For example, as some of you recall, we've utilized expert support in things such as the creation of our EHV prioritization process for those program standards and models creation, and many other projects. So this is also one of those projects where we'll need that type of support. Thus, we are envisioning the coordinated entry project to include the following, which is what's displayed on the screen. At this first stage, we will utilize the work group in aiding in the creation of the plan for design or for redesign, including our technical assistant needs, so that we can begin seeking that expert support, as well as possibly creating a temporary prioritization plan to implement while the project is underway. Then over the summer, we hope to solicit expert support with the work group aiding in the selection of a qualified candidate to provide support to the project. Once selected, the project will launch, and then it's possible at that time a new work group be created or expanded or adjusted to include wider representation. Then hopefully the project is completed by this time next year so that we may launch a new tool and prioritization process. Next slide, please. So again, at this stage of the project, the stage of the role of the CE work group is envisioned as follows: a 5-meeting commitment of 2 hours each meeting. There may or may not be some email correspondence or minor homework to complete between meetings. This looks like 2 meetings dedicated to creating a plan for the redesign process and 2 dedicated to exploring a temporary prioritization process. And then finally, a last meeting to reveal our final product or an additional placeholder for any carryover items. Also important to note that these meetings will be held virtually over Zoom, and we want to hold them either weekly or bi-weekly through May. So starting very soon in the next couple weeks and early June, with the completion occurring prior to the next oversight meeting. And again, this is just for our very first stage of what the work group will work on. Next slide, please. So what does the CE work group membership look like at this stage? In terms of who will make up the work group, this will be a group of roughly 8 individuals, give or take, plus the support of myself and Jamie Schechter. And we'll also have our coordinated entry team, or at least one of our coordinated entry specialists, attend the meetings as well. This includes up to 5 oversight committee members, so hopefully some of you guys today. And the remaining spaces then going to people with lived experience. We've designed the group in this way to uplift the voices of people with lived experience, even from this very early stage in the work. So we're kind of being intentional about, at this point, making sure a large chunk of those spaces go to folks with lived experience. Oops, excuse me. But it's also important to note that this is only an initial work group to get us started. As the project moves along and with the support of an outside expert consultant, we expect a new work group or other tool for engagement to be created with even wider participation and representation, such as from providers, the wider public, and other stakeholders in our system of care.
Mary, I have a question. This is Wayne.
Yes, go ahead.
One of your scope of work for these initial meetings includes a possible temporary prioritization plan. Does that mean a temporary replacement for the VI SPDAT?
Yes.
What does that mean?
So what that means is similar to how we operated EHB, it would be a prioritization plan, because what an assessment can do is take a year or more to come up with, right? It's a really long process, but that doesn't mean we have to live with the VI for that time period. We know the VI is not giving us what we want out of it. We know it's leading to inequitable outcomes. And so one of the goals of the work group will be to come up with so what do we do in between? And that could be a temporary prioritization process. We learned from EHB, we can do that quickly if we need to. Not perfect, so we're not going to reuse the EHB prioritization process, but it could use other ways of prioritizing folks for housing that doesn't rely on a self-report assessment.
My concern with that is it might cause more problems than it solves, because we go from a known horrible tool to an unknown tool to something we don't know yet. And the VIs for that being replaced is being discussed in COCs all over the country, my understanding. So this is not an easy task. I'm very interested in being a part of this, but I'm also very interested in not hurting people in the process.
Absolutely. And as you said, it's being discussed across the country, and a lot of communities have adopted something as an interim measure as well. So we won't be starting from scratch, picking up something just from our brains. We'll definitely in these meetings be discussing what we've seen across the country, potentially internationally, as effective systems that maybe we want to look at and see how we can adopt for our community.
So you're saying there's prior art we can look at? We're not.
Exactly.
Okay.
Exactly. And Deanna, your hand's full.
Sorry, clarifying question. Prior art to look at in these first 5 meetings, or that's really the work of the next committee? Because that's a big project. I just don't know how we're going to do that work in 5 meetings between now and then. I'm with Wayne. I share the concern that in our rush to throw out the VI SPDAT, we may inadvertently create a system that is just as harmful or worse. And kind of working with the devil you know versus, and I was part of the developing prioritization process for the EHVs and moving on and things, and that was a long process. That took a lot of time as well.
So I think part of we'll be looking at art that we can look at for both kind of phases. And in the first chunk, what we'll be looking at is how did other communities do this, so that we can then say, okay, well, do we know we're going to need 6 months to do this, a year? What does engagement and stakeholder input look like? What does authentic engagement look like? What sorts of supports might we need to bring in to help us through this process? So it'll help us develop that plan rather than make decisions on what an assessment tool looks like in those first 5. And on the other hand, we can also be looking at, and what did other communities do while they were working their plan, while they were working with consultants and stakeholders and whatnot to create that assessment? How did they approach not using the same harmful tool? What are lessons we can learn from them? And, we're not saying we're going to stop using the VI tomorrow. This committee can help us say, maybe the right time to cut it off is 1 month, 3 months, 6 months, and use this thing, whatever it may be, as that interim for 1 month, 3 months, 6 months, however long we need to.
It's not the tool, it's the training in the providers. You've got a tool that we know is inadequate, but you've also got a set of community providers that know how to use the tool and how to work with it, how to interview according to it, how to be more mindful in places that the tool is not, and so you created a huge customer service problem, which may alienate the people we're trying to serve. I am more inclined to try. Now I'm jumping the gun here. But I'm also saying that do no harm should be the first, should be the first thing. We just finished talking about the program models, which are excellent, and we're already talking about adjustments that need to be done there. And these are known things. So here I'm more cautious. So just put that out.
Understood. And it's the devil we know, so we know the harm it's causing. So I think we're going to explore what it might look like to not have that, and to see how we can transition gracefully and not alienate exactly the conversation we'll be having.
And Wayne, I think you raised an excellent point. There's sort of what the committee can decide. And then it's a 6 to 9 month process to roll it out to the provider community that's actually implementing this
Yes.
new system.
Yes.
I'm a little cautious about starting a whole new system in the process while we're developing maybe a third new system.
Yes. Yes.
You just change management and all that goes with it dictates very intentional sequencing.
I would love to jump in really quick. So I want to say that Wayne, Deanne, everyone, I definitely hear those concerns and even share them. But one thing I wanted to say is that in identifying a temporary prioritization process, that doesn't necessarily mean that we're going to be identifying this whole new tool or questionnaire that we need to train people on, and like this whole new set of questions or anything like that, that people need to go and ask participants and kind of like start from scratch. The examples that we've seen and that I hope to share with the work group are what can we gather from perhaps existing data or existing things in HMIS, or things that people always or already enter, and use that to speak to how we prioritize people. So it might not, and I actually doubt that the temporary process would involve like using a new tool that we need to straight out like ask participants and things like that. It might be something that a provider can answer themselves, might be something that we automatically populate from HMIS, or it might not involve lengthy questions at all. This is kind of what we've seen in other communities that have adopted a temporary prioritization process, and done so in a way as to avoid that kind of like further traumatization of our participants. Because I agree that's definitely something we want to avoid.
Mary, Joe has her hand up as well.
Thanks, Jamie. I feel like all the conversations that we've had around this replacing the DI for that, I don't believe that, from what I understand in the conversation based off of other people's input, is that this is the system of hope that we're trying to bring into the system that's flawed. Because that DI for that is absolutely flawed, but when you bring in these 5 meetings that we talk about and bringing that lived experience perspective, we're bringing in a whole different, it's both and, not or, so and then that's like a threading that into them. I think will alleviate all those fears, I believe, because it'll be a message of hope. Because largely, like nationwide, the VA that is going to be replaced eventually. We don't have to do that. But we can thread that needle of hope while we're waiting for that to happen.
And Joe, I agree with you. I absolutely agree. Same. Yeah. However, the new tool will be flawed too. That's the risk.
I mean, the system is definitely not perfect, and neither are we.
Yeah.
But there's still hope.
Yeah. Oh, yeah. Always.
Cool.
All righty. All very good questions. And I think that it definitely can be further discussed in the work group of what best meets our needs. Especially I'm hearing there's a lot of concern around the temporary prioritization piece. So I think that sounds like something we definitely want to look into more once the work group comes together. And ultimately, at the end, any work that any proposals the work group has to bring forward would be approved or discussed further in our next oversight meeting. Alrighty, I'm going to move on. So let's see what slide we're on. Okay, next slide, please. So here's a little graphic of the work group progression at this stage. So now that you had a chance to see kind of a more overview of the larger project and as how the scope of the work group at this stage looks, this is just an additional graphic to demonstrate the overall progression of these next 3 months of the project. So this includes convening the work group, so hopefully getting some volunteers for that today, holding those 5 work group meetings in the month of May and early June, and then finally presenting this work in our next meeting here together. Next slide. This brings us kind of to our call to action to seek out work group volunteers. Now that you guys have all had the chance to see the overview, we'd like to engage interest and ask that some of you participate in the work group. And also, before we jump into raising hands, I want to take a few minutes to answer any questions that you may have from here. I know we had a few, but I did plug in some time for further questions or discussions or anything before we try to get some folks joining the group.
This is Joe. Yeah. The getting the people with lived experience, up to 5 people that are not oversight committee members, where do we plan on outreaching and getting those people with lived experience, and what kind of, I mean, knowing our audience, what kind of people are we looking for specifically, and where do we plan on finding them?
Good question. I'll take a stab at it. So I think we're going to follow a similar process to how we recruited for the satisfaction survey. You know, Jamie J has a strong list of folks who want to be involved, might not be able to commit to a council seat or ongoing sorts of work, but would be interested in this. We're going to try and recruit from there. And of course, always happy to hear directly from you all and hopefully come into contact with. If they, you know, someone who you think would be interested in this, please feel free to refer them. We're going to use you all their network.
So yeah, that's great. So then note to Jamie J, wherever she's at in the grand scheme of things. We had a conversation about somebody who had put a complaint that wants to be involved. And
Yes,
so
yes.
So to keep those people in the loop that into this conversation. Great.
Yeah, we're tracking that person.
Perfect. And then the other thing that I want to recommend is that if we can get some sort of very specific email flyer, something very simple that we can share with the Spirit program, because I think that this might be a very good opportunity for their interns to get involved. Just throwing that out there too. And I have contact to exactly who to contact about that. Great. So I think that would be a good spot too. So.
And Leslie, I see your hand up.
Yep. I know a lot of thought has gone into this process, and I appreciate that. I do note, though, that a number of us on the Oversight Committee are a step or two, or maybe have no connection at all with doing VI SPDATs. So is there room in a work group to have representation from that core of people who are doing them? You know, the program managers or the case managers or core team representatives, someone who actually has day-to-day experience with conducting the assessment and then using it going forward to help people get housing. And then the second part of that question is then who from H3 will, by the natural process of things, be in the work group, in addition to Oversight Committee and people with lived experience.
That's a great point, Leslie. I'm happy to you know, open that up. Of course, we don't want the group to be too big as the only consideration, but I think that makes a lot of sense to have someone who's doing the VI participate in this sort of conversation. We do want to keep the oversight membership low a little bit, just because of quorum purposes. If we've got 6 people, that's a council meeting and we have to be in person. So that's one of the behind the scenes reasons for why we're putting that cap there. But I think that makes a lot of sense.
One
And
thing
who
I'll add,
from H3 will be part of the work group?
Oh, yes, sorry, Mary and I will primarily be point of contact, but we'll be definitely pulling in folks as needed.
yeah. And one thing I'll add too is while the work group at this stage is kind of small and contained, just to really get the project off the ground, and the main point being to help us bring in that expert support that can help us through this whole process that we know will require very in-depth and widespread like community and provider engagement. While at this stage, maybe that might not look like bringing in so many folks to the table because we're just really trying to get lifted off the ground. But down the road, we definitely do want to see that representation and inclusion of voices that actually do the work, are going to be administering whatever tool we identify, et cetera, et cetera.
And Wayne has your hand up.
Yes, just keep in mind, this is a very, every other week is a huge commitment.
Yep.
And particularly, we're looking to attract people with lived experience, and it has been this body's experience that it is difficult to get people to commit to something that,
Yep.
I want us to do the work right and not fast.
Yep.
So if it takes longer, it takes longer as well. And I want to make myself available for this, but yeah, I don't want to get caught up in having to make big decisions by the next oversight committee meeting next week. 5 meetings in 2 months is a lot.
It is, and that's a proposal. Just we want to be able to move quickly on things and not just let them sit for a long time. But if in the course of those meetings and we haven't scheduled them yet, we're going to be reaching out to schedule. If it's not feasible, then it's not feasible, and we take a little bit longer.
Yep. Any other questions, comments, discussion?
I will also volunteer myself for the work group.
Okay, so I just want to, before I move into starting to jot down volunteers, it sounds like no more questions from the group, right? Alrighty, so now we can move to just open it up to let's see if I think I have another slide. Let me see. Okay, so first sorry, my slides that I'm reading off of are a little different than the one showing, so I almost was going to read the wrong thing. So yeah, now we can go ahead and take volunteers. I believe it's up to 5 members from this committee, correct, Jamie, that can volunteer to serve on the work group. So if you guys would like to raise your hand, either virtually or in the room, and maybe we can go through, I don't know, maybe alphabetically or just as we see them.
So I think Juno's got her hand raised. Juno, is that to volunteer?
Yes, it is.
Great.
Okay.
And then I heard Wayne and Joe already. You're not setting your life in stone if you want to volunteer, because we know we haven't scheduled the meetings yet. And if you don't want to volunteer, we will be sharing scheduled meetings. And if they work for you and you're interested, you can join later on. But again, we're trying to keep this low barrier. So that means less than 5 or less oversight committee members joining. But we've got 3, it sounds like, who are in that interest phase. Okay.
So
And
we
Mary, will
have,
you drop your email in the chat so folks know how to reach you, and we can include in follow up just in case you're noodling on it and want to join at a later time.
yep. And there's my email. So I hear that we have Wayne, Joe, and Juno. Any other takers? All righty. I think that was it. Okay, well, thank you, everyone. I will turn it back over to whoever is next.
Great, that's me. Just as a wrap up. You wanna and so at this point, we'll do a quick wrap up. The screen before that So I think at this point, share announcements, if anybody has any announcements from the providers or from the community members. I do have something that I want to bring to the board, the table. But if anybody has any announcements or anybody on virtually. I don't see anything virtually though.
I'll share just real quickly as a reminder to folks, we have our funding committee and governance meeting next week. Those are meetings where things around Council on Homelessness bylaws and scoring tools for the COC competition get discussed and decided on. So if you are a provider who gets funding from the COC and want to have input on how you are scored in that process, that's a great meeting to join in. And if you are a council member and you want to have input on how the council is structured, the governance committee is a great one to join in. That's a Thursday, the 27th in the afternoon. They're back to back here in this room starting at 12:30.
Cool. Anything else? So I have, and I brought this up in other meetings before, but I have 2 documents that I would like H3 to share with the equity group. So then us as a group can all go through it and kind of edit it because they need to be updated. There are some concerns that I have, and I think that they just need to be looked at. And I wasn't sure how that process goes. Like, do I just tell you guys what documents they are, and then, or do you want me to send? Like, I don't even know how I got these documents, but they were just a complaint panel, and then. So one of them is the Continuum of Care Homeless Management. It's the HMIS Privacy Notice. That's one document, and then the other document is the Homeless Encampment Action Protocol. Those 2 documents I would like for us to look at as a group and bring our feedback in, because they both need to be updated.
So the HMIS privacy notice, that would likely be under the purview of the HMIS policy committee. I'll just flag that.
They told me to bring it here.
Oh,
Hello.
well, then we'll straighten ourselves out and figure
So
out.
wherever that needs to go, let's have that conversation. Let's get the policy fit.
Interesting. Okay, yeah, agreed. That is one we're talking about as well, because with the expansion of CalAIM and all of these new resources and partners we've got in our community, we definitely need to be keeping our eyeball, make sure folks are aware of their rights and who might be accessing their data to get to them to housing. So I love that you brought that up. And the encampment abatement protocol, that I believe hasn't been updated in 2018. I want to say.
Yeah.
I want to see
An
that.
old one. And I think that would likely have involved Public Works as a partner. Yep. Seen had not great, predating my time, but I'm still on the right track. And I think that could possibly be a really interesting document to update, especially with the implementation of the encampment resolution funding that we've seen in Richmond, and potentially more communities as more funding comes out, and see how we could learn from them to update it. So thank you for bringing those both.
Indeed. The next slide, if there's no more announcements. Our next meeting will be Thursday, June 15th from 11:30 to 1:30. Same that place, same that channel. Next slide. Upcoming meetings, Jamie mentioned a couple of them, but this is it. That looks really good. Next slide. Oh, look at that. It's the end of the slide. Good job, everybody. Huzzah. All the emojis.
Jazz.
Yeah, jazz hands. That's the end of the, where are we in? This is equity, no, this is.
Oversight.
Oversight. Who's on first?
Oversight Committee. Thank you, everybody.
Thank you.
Have a nice day. Enjoy the sun.
Bye. Thanks, everyone. Take
Thanks,
care.
everybody. Have a good day.
Have a good one.
Recording